Hi everyone, welcome back to my YouTube channel. Today I will be talking about the final rule that Medicare released on November 2nd of this year regarding hospital outpatient prospective payment system and ambulatory surgical center payment system for calendar year 2022. On November 2nd of 2021, the Centers for Medicare and Medicaid Services or CMS finalized Medicare payment rates for hospital outpatient and ambulatory surgical center or ASC services. In addition to updating the payment rates, the calendar year 2022 Hospital Outpatient Prospective Payment System or OPPS and Ambulatory Surgical Center Payment System final rule includes policies that align with several key goals of the administration, including addressing the health equity gap, fighting the COVID-19 public health emergency or PHE, encouraging transparency in the health system, and promoting safe, effective, and patient-centered care. Some of the key takeaways from this final rule are as follows. Price transparency of hospital standard charges. CMS is committed to ensuring consumers have the information they need to make fully informed decisions regarding their health care. Hospital price transparency helps people know what a hospital charges for the items and services it provides. CMS expects hospitals to comply with these requirements and is enforcing these rules to ensure people know what a hospital charges for items and services. Increase in civil monetary penalties or CMP. CMS is setting a minimum CMP of $300 per day that will apply to smaller hospitals with a bed count of 30 or fewer and a penalty of $10 per bed per day for hospitals with a bed count greater than 30, not to exceed a maximum daily dollar amount of $5,500. Under this approach, for a full calendar year of non-compliance, the minimum total penalty amount would be $109,500 per hospital and the maximum total penalty amount would be $2,007,500 per hospital. This approach to scaling the CMP amount retains the current penalty amount for smaller hospitals, increases the penalty amount for larger hospitals, and affirms the administration's commitment to enforcement and public access to pricing information. Deeming state forensic hospitals as having met requirements. CMS is modifying the hospital price transparency regulations deeming policy to include state forensic hospitals as having met the requirements, so long as such facilities provide treatment exclusively to individuals who are in the custody of penal authorities and do not offer services to the general public. Prohibiting additional specific barriers to access to the machine-readable file. CMS is updating the regulation's prohibition of certain activities that present barriers to access to the machine-readable file, specifically requiring that the machine-readable file be accessible to automated searches and direct downloads. Updates to outpatient prospective payment system and ambulatory surgical center payment rates. In accordance with the Medicare statute, CMS is updating the calendar year 2022 outpatient prospective payment system payment rates for hospitals that meet applicable quality reporting requirements by 2%. This update is based on the projected hospital market basket increase of 2.7%, reduced by zero point 0.7 percentage point for the productivity adjustment. CMS is updating the ASC payment rates for calendar year 2022 by 2% for ambulatory surgical centers that meet applicable quality reporting requirements. Use of calendar year 2019 claims data for calendar year 2022 outpatient prospective payment system and ambulatory surgical center payment system rate setting due to the public health emergency. CMS believes the calendar year 2019 data as the most recent complete calendar year of data prior to the COVID-19 public health emergency are generally a better approximation of expected costs for calendar year 2022 hospital outpatient services for rate setting purposes. As a result, CMS is generally using calendar year 2019 claims data to set the calendar year 2022 outpatient prospective payment system and ambulatory surgical center payment system rates. Changes to the inpatient only or IPO list. In the calendar year 2021 outpatient prospective payment system slash ambulatory surgical center final rule, CMS finalized a policy to eliminate the IPO list over a 3-year period, removing 298 services from the IPO list in the first phase of the elimination. CMS received a large number of stakeholder comments throughout the calendar year 2021 rulemaking cycle and following issuance of the final rule, with comment period that opposed the elimination of the inpatient only list primarily due to patient safety concerns, stating that the IPO list serves as an important programmatic safeguard. CMS is finalizing its proposal to halt the elimination of the IPO list and add back to the IPO list the services removed in 2021 except for CPT codes 22630, which is for lumbar spine fusion, 23472, that's for reconstruction of shoulder joint, 27702, and that's for reconstruction of ankle joint, and their corresponding anesthesia codes. This change in policy promotes transparency and ensures that any service removed from the IPO list has been reviewed against Medicare's long-standing IPO list criteria to determine if it is appropriate for Medicare to pay for the provision of the service in the outpatient setting. Two-Midnight Rule medical review activities exemptions. In the calendar year 2021, outpatient prospective payment system slash ambulatory surgical center final rule, CMS established a policy in which procedures removed from the inpatient only list beginning January 1, 2021 would be indefinitely exempted from certain medical review activities related to the Two-Midnight policy. This policy change was made to accommodate the unprecedented number of procedures being removed from the IPO list beginning in calendar year 2021 due to the elimination of the IPO list. For calendar year 2022, CMS is finalizing the proposal to halt the elimination of the IPO list and to return the majority of services removed in calendar year 2021 back to the list. CMS is also finalizing the proposal to revise the exemption for procedures removed on or after January 1, 2021 from the IPO list to the exemption period that was previously in effect, that is a 2-year period. Changes to the Ambulatory Surgical Center Covered Procedures List or CPL. For calendar year 2022, CMS is reinstating the criteria for adding procedures to the Ambulatory Surgical Center Covered Procedures List that were in place in calendar year 2020. In the calendar year 2022 outpatient prospective payment system slash ambulatory surgical center proposed rule, CMS requested comment on whether any of the 258 procedures proposed for removal from the ambulatory surgical center covered procedures list met the proposed reinstated criteria. CMS received 140 procedure recommendations, including new procedures and procedures that were already on the CPL and not proposed for removal. Based upon review of these procedure recommendations, CMS is keeping 6 procedures, 3 that were already on the ambulatory surgical center covered procedures list and 3 that were proposed for removal, and removing of 255 of the 258 procedures proposed for removal. The 3 codes that were proposed for removal and are being retained are CPT codes 0499T 54650 and 60512. CMS is also finalizing the adoption of a nomination process which will begin in March 2022 to allow an external party to nominate a surgical procedure to be added to the Ambulatory Surgical Center CPL. If CMS determines that a surgical procedure meets the requirements to be added to the Ambulatory Surgical Center covered procedures list, including a surgical procedure nominated by an external party, it would propose to add the surgical procedure to the Ambulatory Surgical Center covered procedures list for January 1st, 2023. Outpatient prospective payment system payment for drugs acquired through the 340B program. In this rule for calendar year 2022, CMS is finalizing its proposal to continue the payment rate of average sale price or ASP minus 22.5% for certain separately payable drugs or biologicals acquired through the 340B program. Under the final rule, rural sole community hospitals, children's hospitals, and PPS exempt cancer hospitals would continue to be accepted from this policy. Payment for non-opioid pain management drugs and biologicals under Section 6082 of the Support Act. Section 1833T22A and Section 1833I8 of the Social Security Act, as added by Section 6082 of the Support Act, requires that the Secretary review payments under the Outpatient Prospective Payment System and Ambulatory Surgical Center for opioids and evidence-based non-opioid alternatives for pain management to ensure there are not financial incentives to use opioids instead of non-opioid alternatives. For calendar year 2022, CMS is modifying its current policy to provide for separate payment for non-opioid pain management drugs and biologicals that function as surgical supplies in the ambulatory surgical center setting when those products meet certain criteria finalized in this rule. CMS is finalizing its proposal that beginning January 1st, 2022, a non-opioid pain management drug or biological that functions as a surgical supply in the ambulatory surgical center setting would be eligible for separate payment when such product is FDA approved, FDA indicated for pain management or as an analgesic, and has a per day cost above the outpatient prospective payment system drug packaging threshold. Partial hospitalization program. The calendar year 2022 outpatient prospective payment system / ambulatory surgical center final rule updates Medicare payment rates for partial hospitalization program or PHP services furnished in hospital outpatient departments and community mental health centers. The partial hospitalization program or PHP is a structured intensive outpatient program consisting of a group of mental health services paid on a per diem basis under the outpatient prospective payment system based on partial hospitalization program per diem costs. Update to partial hospitalization program or PHP per diem rates. CMS is finalizing its proposal to maintain the existing unified rate structure with a single PHP ambulatory payment classification or APC for each provider type for days with 3 or more services per day. In order to maintain consistency with outpatient prospective payment system for this calendar year 2022 rate setting, CMS is finalizing its proposal to use calendar year 2019 claims and the cost information from prior to the COVID-19 public health emergency, that is the cost information that was available for the calendar year 2021 OPPS/ASC rule making. CMS believes this is appropriate and necessary for partial hospitalization program services because of the substantial decrease in the number of PHP days in the calendar year 2020 claims dataset which we would normally use for rate setting. So far, I have covered a lot of information regarding the final rule in this video. Some elements of the final rule that pertain to radiation oncology model and hospital outpatient/ambulatory surgical center quality reporting programs will be presented in the next two upcoming videos. Hope you found this information useful today. If you enjoyed this video, please consider subscribing to my channel. Thank you for joining me. Take care. Bye now.